Lower back pain is something almost everyone deals with at some point. The good news? There are actually a lot of ways to manage it, and even prevent it. Still, it's one of the most confusing and misunderstood issues out there. Maybe it hits you like a sudden sharp pain, or maybe it's that dull, nagging ache that sticks around for weeks and just won't go away. Either way, lower back pain can mess with your daily life, from walking to sleeping and everything in between. But here's the thing, most back pain can be handled, and a lot of it can be stopped before it even starts. In this video, we're getting real about lower back pain, what causes it, what signs to look out for, and most importantly, how to deal with it and get your freedom of movement back. So sit back and let's get into it. What is lower back pain? Lower back pain is that uncomfortable feeling in the lower part of your spine, right above your hips. It's super common. Almost everyone deals with it at some point. And no, it's not just something that happens to older people. Even young folks can get it, especially if they're not taking care of their bodies. The pain can be anything from a small, annoying ache to something much more serious that sticks around for a long time. Most of the time, it's caused by pulling a muscle or straining something in your back. But sometimes, it can come from bigger issues like slipped discs, arthritis, or problems with how your spine is built. Your lower back has a big job. It holds up most of your body weight, keeps you upright, and helps you move. So it's no surprise that it takes a lot of stress and is easy to wear out. What makes symptoms of lower back pain? Lower back pain can feel different from person to person. Yeah, it's not the same for everyone, and it definitely doesn't have one rule of manifestation. Sometimes it starts suddenly after a specific event like lifting, bending, or a fall. Other times, it creeps in with no obvious cause. Here's a breakdown of the most common symptoms and warning signs. Starting with pains, for example, a sharp or dull pain. The type of pain you may feel like a stabbing, sharp sensation, or sometimes more like a dull ache. Also, it could manifest as a radiating pain. Sometimes, the pain spreads from the lower back to the buttocks, thighs, or even down the legs, a condition known as sciatica. And lastly, on the types of pain we have the positional changes. This type of pain may worsen with certain movements like bending, lifting, or twisting. And it may feel better when lying flat. You may feel like your back is locked up. Stiffness can limit your range of motion, making it hard to stand up straight, sit for long periods, or transition between positions. Next, we have muscle spasms, a very common symptom with lower back pains. After a strain, muscles in your lower back may contract uncontrollably. These spasms can cause intense pain and make it difficult, sometimes impossible, to move or walk. After muscle spasms, someone suffering lower back pain could expect posture problems. This is because lower back pain can affect your alignment. You may find yourself standing crooked, leaning to one side, or having difficulty maintaining a straight posture. Some people also lose the natural curve in their lower spine. Depending on the cause, other signs may include numbness or tingling in the legs or feet, followed by weakness in the legs, which may indicate nerve involvement. Don't forget the pains during urination, menstrual cramps, or during pregnancy. Apart from these, there are more signs that are signals for something way more serious than lower back pains. You should probably see a healthcare provider immediately if your back pain comes with fever, loss of bladder or bowel control, plus severe abdominal pain followed by lightheadedness or fainting. Even sudden unexplained weight loss and night pain that keeps you awake is a sign of a serious health problem. A history of cancer or immune disorders should also be a factor when considering treatment for these symptoms. These could be signs of infections, tumors, or other internal conditions like kidney stones or abdominal aortic aneurysms. Lower back pain is also more common among people over age 30, those with sedentary lifestyles, individuals with poor core strength, and those who are overweight. Mental health conditions such as depression have also been linked to chronic back pain, likely due to overlapping neurological and behavioral pathways. How to beat it. Treatment and prevention. Finally, we're done with all the scary stuff. Now let's focus on something actually helpful. It's time to look at some good news and figure out how to beat this thing. If you've been dealing with lower back pain, the first thing to know is this. Most cases don't require surgery. That's right, you can find relief through non-invasive practical solutions that not only ease the pain, but also help you keep it from coming back. Let's walk through how to get your back and your life back on track. When lower back pain strikes suddenly, your instinct might be to lie down and avoid movement altogether. While it's true that a little rest helps, especially in the early stages, too much rest can actually slow your recovery. Start by taking it easy for a day or two. Give your back a break. Avoid lifting heavy objects and reduce activities that aggravate the pain. But don't fall into the trap of extended bed rest. This can lead to stiffness, muscle weakening, and even more discomfort. Getting up and gently moving after that initial rest period is essential. Simple walks, light stretching, and standing breaks during the day can improve blood circulation, reduce inflammation, and help your body begin the healing process. Once you've gotten through the first few days of careful rest and moderate activity, it's time to focus on strengthening and support. This is where physical therapy really shines. A trained physical therapist will work with you to build up your core muscles, the foundation that supports your spine. They'll help correct any postural issues, identify movement patterns that may be contributing to your pain, and teach you how to move more safely in everyday life. Beyond strengthening, physical therapy also improves your flexibility and balance, which are both critical for preventing future injuries. Many people find that the guided stretches and controlled exercises not only relieve current pain, but also provide long-term benefits for spinal health. The techniques your therapist introduces can become part of your regular wellness routine, and some are so calming and relaxing, they double as stress relief. Once you've built a foundation of strength and flexibility, you can explore other therapeutic options to manage pain and tension. Hands-on therapies are incredibly popular for a reason. They work. Chiropractic adjustments can help realign your spine, relieve nerve pressure, and restore natural movement. If your pain stems from misalignment or joint restrictions, chiropractic care may offer noticeable improvement. Massage therapy, on the other hand, targets the muscles themselves. It reduces tension, improves circulation, and helps your entire body relax. It's especially effective for muscular pain, knots, and stiffness. Together or separately, these therapies can play an important role in your recovery. Just be sure to consult with a licensed practitioner and ensure the treatment plan fits your specific condition. As helpful as these treatments are, one simple truth remains: preventing lower back pain is often easier than curing it. The good news? There are well-established strategies to keep your back healthy, starting with lifting properly. Always bend at the knees and keep heavy items close to your body. Never twist while lifting. Next, you need to watch your weight. Excess weight puts added pressure on your lower spine. Also, stretching regularly can be a lifesaver, especially before and after physical activity. Stretching keeps your muscles limber and reduces the risk of strain. Prolonged sitting, especially with poor posture, can wreak havoc on your back. Take frequent breaks, walk around, and adjust your chair and desk for ergonomic support. And don't forget to stay active. Regular movement keeps your spine mobile and strong. Even light daily activity like walking can make a difference. For those of you who love partying, you might need to avoid smoking and heavy drinking. Both habits can impair blood flow and weaken spinal tissues over time. If you've been struggling with back pain, it's important to know that you're not alone. This is one of the most common physical complaints in the world, affecting millions of people from all walks of life. Whether your issue is a mild strain from poor posture or something more complex like a disc problem, help is out there. With the right information, a thoughtful treatment plan, and a little consistency, recovery is not only possible, it's likely. Sometimes all it takes to turn the corner is a small push in the right direction. By embracing these simple, proven strategies, you can take control of your health and move forward with strength and confidence. Your back may have been holding you back, but it doesn't have to anymore. Hope you enjoyed today's content on lower back pains. By now, most of us would have realized that it really doesn't take that much to live healthy. What's most important is living right and doing the right things. Don't forget to like, subscribe, and drop your questions in the comments. Also, check out our website for a free second opinion and other useful information. Stay strong, stay healthy, and take care of your back. Thanks for watching.